Welcome. This is Chapter 7, the skeletal system. In the past chapters, in Chapter 6, we looked at bone tissue, we looked at bone fractures, we looked at bone growth, and how bones are remodeled and repaired. So, with that basic understanding, now we're going to look at bones as they are articulated and put together as the whole skeletal system and look at major anatomical structures and how these structures correlate with the skeletal system and work together with the muscular system to provide that musculoskeletal movement that we all benefit from. So when we look at this anterior and posterior view here of the skeletal system, we see the major bones of the skeletal system, 206 bones in the adult skeletal system put together. And we're going to be going today through the skull, or the cranium, all the way through, I think, the vertebral column, and we'll end at the coccyx. And then in part two, we'll pick up the rib cage and the appendicular skeleton. So let's see if we can zoom in a little bit here. Oh, I don't know if I can. Yikes. Okay. That's going to be a bummer. But when we look at the anterior view here, you see in pink the axial skeleton that forms that function of protection of the cranial cavity, the thoracic cavity. Okay. And in normal bone color here, you see the appendicular skeleton, which provides that muscular movement. Pay special attention how the clavicle and the scapula are part of the appendicular skeleton and not the axial. So they are involved in movement, not so much protection. When we look at individual bones, and I want to spend some time here with bone markings, there's a number of surface features and markings on bones that can tell us a lot. And they have a lot to do with the major function of that bone. So, are they allowing vasculature to go through? Are they providing other articulation points in different types of joints? Are they allowing the or origination of muscles and tendons, that type of thing? So that's mainly the purpose of going through these bone markings. Let's go over depressions first. So these are going to be either convex or concave indentions or structural indentions on or pits on bones. So this first one here on a costal, you see the facet. So they provide articulation surfaces for joining up here with the vertebrae. Then you have a fossa. This is a indention where one bone can fit into another. Here you see the humeral distal fossa here that's going to articulate with the proximal end of the ulna. Okay, then you have a shallow pit here. This is of the humeral head, the fovea of the humeral head. You see a groove here. This is a long indention. It's right here, a long indention that's going to allow there again for some articulation, no, excuse me, some attachment point of muscles and cartilage and so forth. Then we look at openings. Okay, you have openings or holes that are going to allow blood vessels to go through. Here you see your external acoustic meatus of your temporal bone. So this is an example of a canal, your ear canal. Okay, it's going to be kind of a tunnel through a bone. Then you have a fissure that is a narrow slit usually between two pairs of bones. I really wish I could zoom in here. I don't know what I did wrong there, but if you look real closely in your textbook, you'll see this fissure here in the sphenoid bone, and also one here in the frontal bone. And then foramina, okay, or foramen, singular, foramina, plural, that are holes in bones that are going to allow vasculature to go through. Then we have all different kinds of projections and protuberances and all of those things. So a condyle is simply a rounded end of a bone that's going to allow movement with another bone. So here you see your mandible here, mandibular condyle. A crest is a ridge or a projection here, the iliac crest here of the coax or the hip bone. Then you have a head. We spoke about that before. The head of ball and socket joints, such as your humeral head, your femoral head. Then you have these smaller tubercles or tuberosities that are going to allow projection points of musculature. Okay, your epicondyles, your processes, and your spines. So an epicondyle is simply a small, rounded, smaller, obviously, than a tuberosity, but it's going to usually be on the distal end of a bone, whereas a tuberosity or a trochanter is going to be on the proximal end. So epicondyles are usually on the distal end. Processes are prominent bony-like projections. Okay, so different in a way from a ridge, or excuse me, of a crest. Okay, a process is more prominent, so it's going to be a little bit more deeper here. You'll see that example on the scapula when we get to it. It's going to have a spine, a sharp, spiny area here. And then lastly, a protuberance is simply an outgrowth of a bone. So think about the pulling of, or excuse me, an attachment point for a muscle, the origination point of a muscle. Trochanter is a large uh, um, tuberosity, and that's only found here on the femur, okay, because it is the largest bone in the body. And then you have a line, a narrow ridge here. So bony prominent or bone markings. Let's take a moment here to look at features of the cranium here. Okay, so the skull consists of two bone groups. You have your cranial bones and then your facial bones. So your cranial bones and then your anterior facial bones. So let's look at those and talk about some of the major characteristics of those. In orange here, you have your frontal bone that forms the forehead or that makes up the forehead. This is where you'll find your sinuses, your frontal sinuses, that hollowed area of the bone here. And it is forms part of those paranasal sinuses as well. In yellow here, you have your parietal bones. You have two parietal bones, one on the left, one on the right, that form the superior wall of the cranium or the cranial vault, and they meet here at this sagittal suture. And you see the coronal suture here that's going to join the frontal and um, parietal bones here. You have, it's hard to see the occipital bone here, kind of in blue. There again, I wish I could, let me see if I can find an inferior view here. Yeah, right here. You see your occipital bone here in blue. It forms the posterior part of the cranial cavity, and you see the major aspect here of the occipital bone is the foramen magnum, meaning big hole, okay, where the spinal cord is going to process through or pass through. And you see these occipital condyles here that are going to articulate with the atlas vertebrae, the C1 vertebrae. Let me go back up here again. All right, you see the temporal bone here in green. You have your two temporal bones that form the lateral walls of the cranium, and they are very unique in the fact of this external acoustic meatus and the tympanic region here of the temporal bone. But also when you look inside, oh, where's that picture? Right here. Also, when you look inside here, you see the petrous region, which is on the internal medial surface of the temporal bone, and it forms that middle cranial fossa that has your jugular foramina in it, and it also has the carotid canal in it. So some very important structures here of your internal temporal bone. Okay. Then we see we have, I'm going to have to go back to those internal pictures here because the rest of the cranial bones are going to be inside. Let's see, we talked about occipital. Oh, your sphenoid bone here. Let's go there next. It's kind of unique in the fact that your sphenoid bone is deep. It's one of those deep cranial bones. As you see, it goes internally here. Okay. And it's unique that it articulates with every other cranial bone to form that internal medial cranial fossa. And it's a pretty interesting structural feature here, and an internal structural feature. So make sure you take a look at that. Pretty unique. Um, and then let's move here to some of the facial bones. You have your nasal bone, so right here, your nasal bones, you have your lacrimal bones, and you have your zygomatic bones here in purple. Okay, so the two nasal bones form the bridge of your nose, and they articulate together with hyaline cartilage that forms the framework of your nose. Then you have your lacrimal bones that are the smallest and most delicate facial bones. They are in the medial orbit wall here, and they allow the lacrimal fossa through which your tears drain. When we look through or look at the special senses here, I think that's our last chapter that we're going to cover this semester. We'll look at that again and look at the internal structures of the eye orbit, the eye globe, and how that lacrimal bone allows passageway for tear drainage. And then, of course, your zygomatic bones here, your cheek bones um, that form that zygomatic arch here. Your palatine bone, that's kind of hard to see here. Let me go to that in because it's more of an internal. Let me go inward here and find that. Here we go. That forms, if you look at this posterior view here, it's really hard to see. I wish I could zoom in, but it forms the hard palate. The posterior portion here forms your hard palate. Okay. And then lastly, we have your mandible here. Well, not lastly, but then we have let's do the maxilla first. You have your maxilla here, the two primary bones of the maxilla that help to form your upper jawbone. They fuse together. And this is where your superior teeth reside and are embedded here in the maxillary bone. You have your internal vomer bone here, the vomer bone that forms your septum, okay, your left and your right nasal septum. And then you have your inferior nasal conchae or concha. We'll go and look at those in more detail. You have a superior, a medial, and an inferior nasal concha, excuse me, that are going to help move and push air through. Um, Part of your ethmoid bone that form that superior nasal concha, middle nasal concha that are part of your ethmoid bone. And then you see your inferior nasal concha here. You can see a little bit of it right there. And then lastly, your mandible is the inferior jawbone, the only one that technically is movable, the movable part of the skull. It forms your chin. You see the mandibular chin here. You see your mental foramina here that's going to allow in vasculature and nerves here into the chin area, lower jaw area. You see the mandibular angle here that makes up the mandibular rami here, and it's going to articulate here with the mandibular condyle and articulate here with the temporal bone to form the temporal mandibular joint that allows that movement that we spoke about. So let's take a look here at some other. So here's a anterior view. You can clearly see some of those internal bones that we spoke about. You see the frontal bone, sphenoid bone, palatine bone. You see here a clearer picture of the fissure here, the sphenoid bone, supraorbital fissure inside here, inferior nasal conchae, zygomatic bone. Let's do another lateral view here. I love how your textbook gives you a lot of examples, so make sure you look at that. A lot of good examples here. Here is a, posterior view, kind of looking up, and you can see here the palatine bone that we spoke about that forms that hard palate. Your zygomatic arches here. You can see the unique features here of the temporal bone that we spoke about. Okay, with those carotid canals and things. You see clearly the foramen magma here, or magnum of the occipital bone. And then, ooh, here's a very good view, the posterior view of the cranium. You see your sagittal suture, your lambdoidal suture here that's going to join the left and right parietal with the occipital. You see the external occipital tuberance we spoke about, or protuberance we talked about here. Okay, that notch here of the foramen magnum. Some interesting features. And this one here, this lateral kind of mid-sagittal view, that kind of introduces us here to the sinuses. So sinuses are simply these hollowed areas within the skull that are have serve multiple purposes to aid in pressure control, help to moisten air, and some other aspects. You have several different sinuses within the cranium, and paranasal sinuses, frontal sinus, okay, that you see here. So those hollowed areas of the brain, you see part of that palatine bone we spoke about, gives us a lot of good cross sections here of the cranium. Okay. Another close-up view here of that supraorbital fissure, palatine bone. So make sure you spend a little bit of time here looking at those features. This is the concha I spoke about earlier. These kind of, how would you describe them? These, they direct air. So they move air and are lined with specialized tissue that help to moisten the air, help to trap particles. They lighten the skull, and it helps with giving you your voice its unique sound. Okay, because everybody's cranium is shaped a little bit differently. So the connection here and the shape of your sinuses helps to make your voice unique. All right, and you see those here, the different sinuses and concha. Okay. Frontal sinuses, sphenoid sinus, okay. Nasal cavity. Then I wanted to compare and contrast the adult skull with the fetal skull real quick and make sure you understand fontanelles. So fontanelles, you may know them as soft spots, but these are membranous areas where the plates or the cranial bones have not ossified. So it is kind of an um, intramedial connection before full ossification can take place. And that usually happens between 18 and 24 months. So on this lateral view here, you see the two of the three main fontanelles. You have this anterior fontanelle here, and you see the mastoid fontanelle here. Remember, mastoid named here for the mastoid process here of the temporal bone. Okay. You see the sphenoid fontanelle here. These are the soft spots that are in place until about age 2 for children. This is a very good superior view of the anterior fontanelle. Then we have your hyoid bone, which is the only bone, believe it or not, that is not, well, not part of the skull, and it really does not articulate with any other bone in the body. It's kind of suspended in the neck by muscles and ligaments that attach it here on the anterior aspect of the neck, and it's important for attaching different muscles and including your tongue and allowing in the swallowing and speech process. Okay, so some of the major aspects here of the hyoid bone, it's unique in the fact that it does not articulate with any other bone. So you have the hyoid body, the lesser horn, and the greater horn. Moving on to the vertebral column. So C, T, and L are the abbreviations for the vertebrae that make up the vertebral column or spinal cavity. So C1 through 7, these are your cervical vertebrae, and notice how they are more concave in shape, this natural curvature of the spine we're going to talk about. You have the thoracic vertebrae, you have 12 of those that are more convex. Then you have your 5 lumbar vertebrae that go again more concave, and then your sacral vertebrae and your coccyx that again are more convex. So it's this slight kind of S type shaped curve of the spine. Let's look at each one in particular and talk about some of the major features of how you can tell the difference between a cervical, thoracic, lumbar vertebrae. Okay. We'll come back to, well, no, let's go ahead and do the curvatures here. So we looked at right here the normal curvature of the spine. Let's look at some of the abnormal curvatures. So here you have scoliosis, which is a slight S curve shaped, okay, more of a lateral S shaped curve that is in the thoracic vertebrae here. It can be mild, which requires no treatment, or it can be severe in the fact here that you see it can impact the heart and the lungs and may need to be corrected with back braces and different therapies or maybe surgery. Okay. Then you have what's known as lordosis that affects the lumbar vertebrae. So lordo for lumbar. Here you see, and also known as sway back. It's where you have this exaggerated lumbaric curvature here of the vertebrae, oftentimes seen in pregnant women or overweight people, where it is caused that extraordinary weight here in the abdominal cavity that pulls on those lumbar vertebrae. Then you have what's known as kyphosis or humpback. So this is usually due to arthritis or different osteoporotic bone conditions, vertebral fractures, or other developmental abnormalities that cause this irregular curvature here of the cervical and thoracic, upper thoracic vertebrae. Okay, so scoliosis, lordosis, kyphosis. Okay. Now let's look at the individual vertebrae. I want to begin here with the upper vertebrae, the cervical. So you see here, the first vertebrae is known as the atlas or C1. The first cervical vertebrae is the atlas. It is unique in the fact that it has no body, meaning right here, this is a typical thoracic vertebrae. And this area right here, this most anterior portion of a vertebrae has a body. You see here, there is no body here on the atlas or axis. The atlas or C1 has this anterior tubercle here that is unique, and it also has these two tear-shaped transverse foramina here that are unique in their shape as well. So they're kind of more oblong or oval, where these are more, the transverse foramina here are more rounded. And you also see here the vertebral foramina is more open, whereas here in a traditional vertebrae, it's more of a heart-shaped. Does that make sense? Okay. So some interesting features of the C1. When we get down to C2, oh, and your atlas here, or your C1 is unique in the fact that it's going to articulate with the occipital bone. We mentioned those articulation areas before, and it is because of this bone that you're able to nod your head up and down in that yes movement a little bit. Then you have your C2, or known as your axis. Okay, the second cervical vertebrae is unique in the fact that it has these dens portion here, or this odontoid process or tooth-like process here. And you see where you see this dens process here and right here, how it kind of articulates and kind of butts up against the anterior tubercle here of the atlas, and how it kind of nestles in there. Okay. And that allows for the uh, movement of turning your head left and right. Okay. As in the no, saying no, or shaking your head no. That lateral movement left and right is the axis here. It provides that axis point where we can provide that head rotational movement. Okay, where the atlas is more of that flexion and extension movement in addition to the cervical vertebrae. The axis is that rotational movement. Then we look at the features of a typical thoracic vertebrae, or excuse me, typical cervical here. We kind of spoke about that already. Anything major here? So as you go down, so this is C5. Notice it's you have seven cervical vertebrae together. So as you go on down, you see now we're getting into a larger anterior body, and you're beginning to see more spiny processes on the posterior aspect. Notice here you don't have a spiny process. Here you have a little one. But as we go down here to C5, notice how they go from smaller to larger. Same thing here with the body of the vertebrae. They go from smaller to larger. Okay. Then when we look at a typical superior view here of a thoracic vertebrae, notice how the body is getting larger. Notice how the vertebral foramina here is more of a circular, and you begin to have what's known as these facets. You have a superior costal facet and a transverse costal facet, where the ribs, okay, are going to articulate here with the vertebrae, right? So that's where you begin to see that articulation with the costals. This is a lateral view. Here you see the superior articulation process and inferior articulation process. And you see the body here, and how that spinous process begins to get a little larger and go a little downward. You see how they articulate together, how they kind of fit on top of each other. You have your inferior articular process that's going to articulate with the vertebrae on top and on top and on top, and how they kind of stack on top of each other. Okay. This is a lumbar vertebrae. Notice how we no longer have those superior and transverse costal facets, because we don't have ribs that attach here to the lumbar vertebrae. There are 5 lumbar vertebrae. These are your largest. So you're going to have the largest uh, body aspect here. Notice how there are no transverse foramina here, and you see the major or main foramen here, and you have a larger spiny process. And notice how they begin to stack on top of each other, how the spiny process here is taller, or it's more pronounced when compared to the thoracic spiny processes. This is an excellent example here of how you can tell the difference between a cervical, thoracic, and lumbar vertebrae. So make sure you pay some attention here to this particular one, and understand the difference between the shape of the vertebrae itself, the foramina shape, the spiny process shape, and the does it have the transverse processes or not? Does it have the transverse foramina or not? Okay, some of those features we spoke about. All right, and then lastly, the last vertebrae, the sacrum and the coccyx, the five sacral vertebrae, your S1 through S5 are, they were individual vertebrae and they begin to fuse together. They generally are completely fused together by age 20 to 25 to form this thick triangular shaped sacrum. Okay, it is part of that concave sacral curvature of the spine, and it has a lot of articulation surfaces on it. It has a lot of sacral foramina on it that's going to allow that branching out of the spinal cord to the lower portion of the body. So you see an anterior view and a posterior view here. And you see the auricular surface here where it's going to articulate with the coax or the hip bone. And then lastly, you have your your coccyx here that are your last generally four vertebrae. Usually it's about four. And there again, it's going to be completely fused together by about age 25. All right. So I wanted to end here with this part one of chapter 7. And you see here the normal curvature of the spine, cervical vertebrae, atlas and axis, C1 through 7, your thoracic vertebrae, T1 through 12, your lumbar vertebrae, L1 through 5, and then your sacrum, okay, and then your coccyx, your last ones here. Let me know if you have any questions. We will go on to part 2 next, where we will do the ribs, costals, and the appendicular skeleton.